talk about alcoholism, we have to think in domestic violence, we have to think in big incident of HIV, we have to think in youth crime, we have to think in gang. All these consequences of alcohol are there in the community.
Alcoholism is a disease. It's just like any other disease. Alcoholism has symptoms, alcoholism a diagnosis, and alcoholism has also treatment.
It's not only a disease, or addiction being a disease, not only a disease of the afflicted, but if you're not afflicted, you're affected.
Alcoholism takes people hostage. It takes the person that's afflicted, it takes the family hostage. And this is the only disease that tells the person that has it that they are okay and the world's messed up.
Well, in these 90 minutes, we're going to try to record a panel with this expert, putting in context what is alcohol all about. Our experience was that the police are people that live in our community, that are part of our community, and really are social services people. And we understood, and they understood, that the alcoholism begins in house, in the home, with the parents. And that the only way that we can be successful is if we bring parents and youth to the table, make a task force in the municipality with the police department, business, churches, and everybody, and talk about the problem. Because when we talk about alcoholism, we have to think in domestic violence, we have to think in big incident of HIV, we have to think in youth crime, we have to think in gang. All these consequences of alcohol are there in the community. And sometimes you go to the house of somebody, it's a domestic violence situation, and nobody knows that it's an alcohol behind that. We also understand that the police is in the community a social service person that have to be part and have the sensibility to understand what is going on in the community, and being part of the community will be able to participate in the process and really became a facilitator of a mental health intervention and a facilitator of a prevention intervention. I would like to begin saying that when we talk about epidemiology profile, what does that mean? Because sometimes we use technical words and people say, what is this doctor are saying? Epidemiology profile means how a disease is distributed and with what frequency in the community, and can be by gender, by age, by demographic, by economic, by sociologic. That means that if you go to a community, it can be Haitian, can be Russian, can be any kind of community, and you're going to try to access information in regard to the disease, and you're going to see in what age this disease is established, and in what frequency. And if you see the statistic in South Florida, in the whole state of Florida, we are going to discover that alcohol is right now establishing in people of 13 years old. 13 years old. So that means that we have to be careful, because most of those children take the alcohol out of the refrigerator at home. They don't really go to a liquor store to pick it up. So that's why parents have to be there. If we review what kind of substance in Florida are the youth abusing, we have first place alcohol, second place cigarette, and third place marijuana. That's how it goes. We have cocaine and all that, but these three are the most important substances that are used, and we know that. And we are able, in a wide approach, to combat the situation.
Even today, there are a lot of people out there, even on the papers, on the news, they continue using the terms alcohol and drugs, okay? Every time that we hear a news or anything that's related or chemicals, okay, let's work for a prevention for alcohol and drugs. Let me tell you this, alcohol is a drug, and alcohol is the drug that's most abused in the United States. Actually, alcohol abuse and alcohol dependency is the number 3 cause of deaths here in the States. Cancer, heart problems, and alcohol-related problems. So alcohol it is a drug. Any chemical that comes into our system and alter our mood, our way of thinking, and our way of behaving is definitely a drug. I don't want to start saying what's alcoholism or what's addiction. I want to start with what's not alcoholism and what's not addiction. Because there's a lot of myths in the community. That's a lot of myths on the population because they think addiction or alcoholism is a lack of willpower. Alcoholism is a disease. It's just like any other disease. What alcoholism has symptoms, alcoholism has diagnosis, and alcoholism has also treatment. Okay, we're going to start with the symptoms. One of the very first symptoms is the lack of lack of control. As parents, we have to be very careful because a lot of the kids, they copy their parents' behavior. Lack of control means that we're starting to lose the ability to control the amount. We all know about a social drinker, right? Social drinker is the person that maybe have one or two in a meeting, in a lunch, and a dinner, a social event, has the ability to stop drinking, has the ability to think and say, okay, I'm 30 minutes away from my house, I have to drive, so I'm just going to have two, and I'm not going to have no more, no matter what. Even the friends that are, come on, have one more. A social drinking, a responsible drinker will not take that third or the fourth one. So when we are starting losing that ability, there's a red light flashing. That's one of the first signs that we have to take care of it. And we need to do something about it. Another of the big symptoms, and also that we have to be very, very careful, is when we start getting blackouts. Blackouts is like a short periods of amnesia. The sedative effects of alcohol is getting to the brain and it's putting the brain to sleep. And we do not recall things that we did or things that we said the night before when we were drinking. So those are the two of the many signs that we start seeing at the beginning. Also, family problems. The wife start complaining, the kids start complaining, job problems, DUI, DWI, social problems. Those are, as I mentioned a little while ago, red flashes. We have to pay attention to that. If those red flashes, if those red lights are flashing, is that telling us, hey, be careful, you have to do something about it. That's at the beginning. That's some of the signs. Now, we can make some diagnosis. There are many tools in order to evaluate a person in order to say, well, this person is having a problem or not. The doctor might tell the person, okay, you're having problems with the liver, some exams will be done, might have a fatty liver, it might have already cirrhosis developing. So the doctor might be able to say, listen, you have to start drinking because your liver is already damaged. Might not tell him you're an alcoholic, but it's definitely recommended to stop drinking. Another tool, there are many tools in order to assess an alcoholic person. Through an evaluation, a therapist, a counselor, it can determine if that person is in the progressive and a crucial or chronic stage of alcoholism. Unfortunately, we as a specialist in the substance abuse field, we cannot really make a good assessment of the person because I would say 95% or 98% of the people that sitting in front of me that I'm doing an evaluation to is going to lie. So all the information that I get, I usually multiply by 4. If they tell me that they drink on weekend a 6-pack, I know easily he drinks at least 2 or 3. Through those evaluations, we can make